Today, of course, we're all talking about President Trump, who tweeted this morning he will be released from the hospital, Walter Reed, in about 30 minutes from now at 3:30. So joining us now is Professor and Chair of the Department of Medicine for UCSF, Dr. Bob Wachter. Thank you so much, Dr. Wachter, for joining us.
You're welcome.
So the president is going home to the White House shortly. His doctor, Sean Conley, today says he's not out of the woods yet, but he's met or exceeded all standard hospital discharge criteria. Can you explain to Americans what does that mean? Does that mean we can breathe a sigh of relief?
Well, it sounds like he's doing well. It's a little difficult to tell because we're getting different information every day, and there are some things they're just not telling us. But if what we've heard is all true, then at one level, he has met discharge criteria. He's stable. He doesn't have a fever. His breathing is fine. His oxygen level is fine. The problem is that COVID acts in a way that would make, I think, most physicians wonder about this. And by that, I mean, you can be doing fine, feel fine, and then get very sick very quickly. And that can happen up to a week out from the initial illness. He's also on a medicine called dexamethasone, it's a form of steroid, and it can make you feel really good. He wrote in his note that he feels 20 years younger. That's a thing I've heard many, many times in my career. And we actually warn patients about that. You may feel fine, your fever may go away, your muscles won't hurt anymore, but it's not doing anything to change the course of the illness. So it can be a little bit of a fake out. So the worry is he may be doing fine, but he's definitely not out of the woods, and there is a real chance that he will deteriorate while he's in the White House.
So if you were his doctor, you would not be discharging him. Is that right?
Hard for me to say for sure without actually seeing him, and so all I can talk about is patients like him. And in general, for a patient with COVID, age 74, sick enough to have needed to be in the hospital and to need oxygen and to have an abnormal CAT scan, although we haven't been told what that shows, and who's now gotten 3 medicines, including one's an experimental medicine, to discharge that patient a couple of days later, because they've done fine for a couple of days, would be very, very fast. And in general, we would say to such a patient, it's terrific you're feeling well. Let's give it a few more days and be sure you continue to feel well, because things could go sour very quickly.
All right, well, let's try to piece this together, this timeline, as best we can. I mean, we know that Wednesday morning, it sounds like, is when he got an inkling that he could be positive. So it sounds like Friday he was not doing very well and therefore had to go to Walter Reed, had to have the supplemental oxygen. Tell me, if he has been fever-free since Friday and he's doing better, looking at the timeline, has he passed the critical period, or is it really unpredictable like a roller coaster?
Well, it's not completely unpredictable. If he were fine 7 to 10 days after his initial symptoms, we would generally relax. It's not impossible he would get sicker later, but that would not be something we'd be worried about a lot. But we're now talking about 2 or 3 days after his initial symptoms. And in that case, we still would remain worried that he could get sick. And if he gets sick, it can happen quickly and can go very quickly. Now, of course, he's the president. He goes back not to my house or your house. He goes to the White House, where they have advanced monitoring, advanced medical facilities. And so it's safer than it would be for the average patient. But if he were to get sick and get very short of breath, I think for us, we'd rather have a patient 100 feet away from the ICU as opposed to 100 feet away from a helicopter that's going to have to take them back to a hospital and to an ICU.
What kind of information would you like to hear from Dr. Conley that we really haven't gotten? I know, for example, we still don't know when his last negative test was, but there are other question marks. What could be really useful to you, everybody else, the American public, in terms of, knowing what's going on with him?
Yeah, I mean, just to say it's a tricky situation that the physician finds himself in, because he has a patient who I'm guessing is telling him what he would and would not like to be talked about. And so he's got a twin obligation to his patient and the doctor-patient relationship, but also to the public. Once he strolls out to the podium in the white coat, I think he's acting not as the patient's physician, but as a communicator to the world, really. And so I'd want much more detailed information on following any patient like that. I'd want much more detailed information about his oxygen levels over time, not just the good ones, but the bad ones. He said a day or two ago that it never went down to the low 80s. but didn't say anything other than that. So I have no idea how to interpret that. The CAT scan is a very important piece of information. He said it showed what was expected. I don't have any idea what that means. If it was normal, he should have said it was normal. If it was abnormal, he should have told us what that was. So those are two critical pieces of information. And then I think that given the importance of the president's mental status, you would want to be quite secure that he's thinking clearly. Both the illness and the medication, particularly the dexamethasone, can cause everything from confusion to euphoria to manic kinds of behavior. So that's a piece of data following his mental status very, very carefully that I would want to know.
Yeah, I mean, I know there's some doctors who wonder if his tone is, partly being driven by the side effects of this dexamethasone you were talking about. In fact, he put out a tweet announcing he was going to leave Walter Reed. I'll just read that to you. It says in part, "Feeling really good. Don't be afraid of COVID. Don't let it dominate your life." What's your reaction to that?
Don't be afraid of COVID, of an illness that has killed more than 1 million people in 10 months, and including 210,000 people in the United States. I think we should all be afraid of COVID, not to the point that we crawl under shells and live in total fear. But it is a serious, serious illness that has harmed and killed many, many people. And so it is rational to be afraid of COVID. If you're not afraid of COVID, you won't take the steps that you need to take in order to protect yourself, as apparently the president and others around him did not. So to say to people, don't be afraid of COVID, and particularly in a position where, well, okay, I'm getting medicines that no one has access to. I've got a helicopter to take me back to the hospital. That's not what the average person has. So to me, it came off as insensitive and also counterproductive.
No doubt he has more resources to all the drugs, to the treatments, to the best medical care. Of course, he is the president of the United States. But I am wondering, though, if it turns out that these doctors are giving him drugs that are given normally to people with more serious cases, is that generally considered good medical practice because you're being preventative, for example? Or is that generally considered you shouldn't do that because could be serious side effects on other things that we don't know about yet?
Yeah, I mean, the medications that we know he's received for his infection, 2 of them are standard therapy that we would give to any patient with serious COVID at UCSF. So the complexity here is the messages we're getting from the doctors are, it's not that bad, his oxygen level's okay, his fever is not very high, and yet they're giving him medications that really are only proven to work and proven that the benefits exceed the risks in patients with pretty severe COVID. So there's a little bit of a disconnect there. But the remdesivir, the antiviral drug, and the dexamethasone, the steroid, is something we give all the time to patients who are quite sick with COVID in the hospital. The one that he got that no other patient in the country would be able to get that way is the monoclonal antibodies. That is experimental. It's looking in the preliminary studies pretty promising. So it may very well work, in the fact that he's doing quite well may be a manifestation of that medicine working, but that would not be available to the average patient.
All right, Dr. Wachter, we're going to take a short break on the air, but we'll continue this conversation over on Facebook Live. And when we come back, we want to explore what happens once the president leaves Walter Reed and goes back to the White House, and also about the outbreak that's happening amongst White House staff. So we'll be back with more.
In commercial break.
All right, Facebook friends, we are chatting live today with Professor and Chair of the Department of Medicine for UCSF, Dr. Bob Wachter. Can't tell you how much I appreciate this. I know how busy you are, but getting the information out when we seem to be really needing that at this moment, that's really helpful. I want to ask you, the president, I have heard, will not be going back to the West Wing, is the latest information. I presume he will quarantine in his residence, although I'm not sure. But what do you think is the best course of action for his safety and that of other White House staff?
Well, it's really for the other people. It's not so much for his safety. He needs to be isolated from anyone who absolutely doesn't have a need to see him. So in the hospital, we would be highly limiting the number of people that went in the room. In fact, during our outbreak of COVID, when things got bad, we sometimes rounded on our patients using video, even if we're standing outside the room. So he must go into a room and isolate himself from other people, or else he will be risking their health. I assume he was doing that in the hospital, although of course he took that ride yesterday, and one hopes that he would do that when he went back to the White House.
Now, that ride, a lot of people are talking about it because the Secret Service in that car with him, the agents were wearing N95 masks. If they do that and the ride is not exceptionally long, I assume their chances of contracting COVID from that short ride are very, very minimal?
They're very low, but not zero. And so if they're all wearing N95 masks, the chances are very low. But as I say, in general, for a patient that has COVID during the contagious phase, we limit people coming in close contact with the patient unless it's absolutely essential that they do. So you'll have to make your own judgment about whether that trip was absolutely essential. They're in close quarters in a relatively non-ventilated space. The windows are closed. And so, if it's absolutely essential, if it's a doctor or nurse coming into the room to see a patient, it's one thing. You'll have to make a decision about whether that trip is essential.
All right, coming back on air. Thanks.
Wow.
We are back with Professor and Chair of the Department of Medicine for UCSF, Dr. Bob Wachter. We were chatting during Facebook Live time over when we were in break about what happens after the president gets back to the White House. Can you talk about the setup that they must have there, the medical setup for excellent outpatient care, and what do you think they're going to be looking for in the days ahead?
Yeah, they'll monitor him the way he would be monitored in the hospital. They'll be checking his vital signs frequently, his oxygen level frequently, probably continuously. They will be getting repeat chest X-rays, I imagine. I don't know if they can get repeat CAT scans in the White House. That would be an interesting question. He will get an IV, or at least be getting a dose of IV medicine, because he's not done with his remdesivir, which is a 5-day course. I believe he got his fourth dose today. So he'll need an IV tomorrow. That's not a big deal to do in the White House. So they'll be closely monitoring. It's not the monitoring that would be so worrisome. They're capable of doing the same monitoring there as they can do in the hospital. The issue is if he were to get very short of breath very quickly, which is not likely, but certainly could happen. Then they would have to escalate care, put on higher doses of oxygen on him. And if he got really sick really quickly, what happens in a hospital is people go to the ICU, and we sometimes have to put them on a breathing machine. That's easy to do in a hospital and not that easy to do in the White House, and not all that great to do when you're then having to transport someone back to a hospital.
All right, he's also going back to an environment in which there is sort of a outbreak, if you will, right now. Just today, his press secretary, Kayleigh McEnany, tested positive, or said that she tested positive, along with 2 other staffers. So that makes about 11 people so far. What do you think everybody working in the White House needs to be aware of and do right now?
Well, you need to treat the White House as a place where there's uncontrolled spread. And so everyone needs to use, everyone who can work from home should be working from home and not coming in. If you have to be there, you should be using pristine use of protective equipment, masks, gloves, gowns, things like that, to be eye protection as well. It would be a scary place to be working right now. And certainly the people that are infected need to be in strict isolation. They cannot be walking around in the halls. It doesn't matter who they are.
Now, Vice President Mike Pence is traveling now. The debate Wednesday in Utah against Senator Kamala Harris. The debate commission just approved plans for plexiglass to separate the candidates. Of course, we saw that over the weekend in that South Carolina Senate race debate between Jamie Harrison and Lindsey Graham. What do you think about that? Is that enough to keep everybody safe?
I mean, it would have been ideal. The safest thing would have been for them to debate in separate spaces and do exactly what we're doing. It's a little bit, and to do it in Washington so that they all didn't have to travel. I think that would have been the most prudent thing. Short of that, setting them up so that they're a fairly far distance away, at least the 12 feet that the president and vice president were, but I would vote for more than that, 15 to 20 feet away, plexiglass between them. I think knowing that they will have all tested negative for several days beforehand, I think if you do all that, and either no audience or a very limited audience, all wearing masks, I think you can do the thing safely.
Well, we hope they do test everybody and make sure they're negative for days because, I mean, there were holes in what happened last Tuesday where the testing was left up to each campaign for their entourage and the candidates themselves. That was really hard to understand, actually, because the Cleveland Clinic tested all the attendees, but not the candidates.
Yeah, I mean, there have been many holes there are ways we think about this and what would be the right thing to handle it. And I have to say, in hearing about the way this has been handled, everything from the Rose Garden reception onward, it's easy. You can drive a truck through some of the holes in processes and procedures.
We've got only about a minute left, but I got to ask you about the CDC's actions today. They put back onto their website information that COVID could be airborne and transmit or spread beyond 6 feet indoors. You know, I feel like that's been out there for a while and not necessarily new to the medical experts. So I got to ask you, is the CDC no longer seen by those in the field as a leading source of medical information? Does it trail instead of lead?
I think the answer to that is yes. I think there are many of us who love the CDC, revere the CDC, know that there are thousands of spectacular people working there doing their very best. But it's very clear that the CDC is operating in a very highly politicized environment where its pronouncements go through a number of layers of filtering. And it has meant that for many of us, we no longer look to the CDC for the most up-to-date information. The information they put out today has been well understood in the medical community now for several months. And luckily, the recommendations about distancing and mask wearing are all consistent with what they said.
All of which leaves the average Joe and Jane quite confused as we make decisions every day about whether to go to that restaurant that is now allowing indoor tables.
Yes, I mean, there is a lot of different sources of information out there, and I think for everyone, they've had to find sources that they deem to be trustworthy. I think for those of us in the Bay Area, we can feel pretty good that our political leadership and our public health leadership has acted responsibly, and when they are making choices of opening certain businesses, they're doing it based on the latest information and with the public health in mind. So I think we're quite lucky that way. There are other parts of the country where that's not been true.
Yeah, well, Dr. Bob Wachter, we're quite lucky that we got to hear directly from you today. Take good care, and we'll check in with you again soon.